Next, we have the question from the member for Ottawa South.
Thank you, Speaker. My question is for the Premier. Premier, last week I asked you about ongoing testing in long-term care, and the response that we received was that we were going to test every resident and staff by this week. And I think we'd all agree that's a good thing. It's just a snapshot. COVID-19 is not going away anytime soon. And long-term care, retirement, and group homes are where we know we're the most vulnerable. There needs to be a plan. So, through you, Speaker, I'll ask the Premier again, what is the plan for ongoing testing and surveillance in long-term care, retirement, and group homes? Thank you.
Minister of Health.
Well, I thank the member very much for this question. This is a really important issue because we know that testing is a snapshot, and it's not something to say that we've got all the residents of long-term care homes tested and that's the end of it. That's going to need to continue on an ongoing basis, as well as the continued testing of staff members as well. And as we contemplate at some stage for family members to be able to come into, that introduces another element of concern and risk. So we will need to have heightened testing in those areas. But we have completed the testing on a first case basis through long-term care homes, residents and staff. We are moving now forward with retirement homes, group homes, shelters, and other places of congregate living. That's very important. And again, that will have to continue to be monitored.
Response?
And testing will need to continue there. But we know that the ongoing testing is also very important in the community as well as certain elements of the economy open up. So we are concentrating on testing in that area as well.
Supplementary question.
And I appreciate the answer, Minister, and the commitment to ongoing testing. You know, I think we need a plan because as we're opening up this economy, we know the pressures that existed around community and testing going on in the community and not in long-term care, and we didn't use capacity when we had it. And that's just a fact. Now we know that in this pandemic that we're going to need more testing and more surveillance. That's what experts tell us. That's what we're going to have to do as we open up the economy. And let's be frank, we're not there. We're not there yet. We know that. So I just want to reiterate that it needs to be a clear plan, because if we tilt too heavy on one side, as we may have, understandably, I'm not criticizing that decision. We should maybe look at that. But let's make sure that we tilt the right way, because if we don't, it's going to have really serious consequences for people living in long-term care,
Question.
and group homes. So, Minister, there needs to be a clear plan, and there is not one yet. Thank you.
Minister of Health.
I can agree with you that there is a need for a plan. There is a need to have ongoing testing, and there is a plan. We do have a plan. We focused initially on making sure that the most vulnerable group was being protected. That's our long-term care residents and staff. We also know that another very vulnerable group is people in retirement homes and other congregate living places. That's what we're focusing our attention on now with ongoing testing in long-term care homes. We're doing the surveillance testing in the public, and we've also changed the criteria, though, for people who are symptomatic, who do have symptoms that they believe might be COVID-19. They may go to assessment centres now, and they will be tested. Previously, it was more up to the judgment of the clinician at the assessment centre. What we are saying now as we're opening up the economy is if you have symptoms of COVID-19, please go to an assessment centre and be tested. That is vitally important so that we can assess the community impact on public health of the opening of the economy. So we really urge people to go to the assessment centres for a test if they believe they have symptoms of COVID-19.